Why shouldn't all Americans who go back to work be able to get a test before they do to feel comfortable in their own work environment to be interacting with other individuals?
Yeah, well, let's dismiss a myth about tests right now. If we tested every single American in this country at this moment, we'd have to retest them an hour later and then an hour later after that, because at any moment you could theoretically contract this virus. So the notion that everyone needs to be tested is just simply nonsensical.
Mr. Mayor, as someone who's in the middle of attempting to test 10 million people, why is she wrong in this case?
Well, it's become a cliche on shows like this to say more testing, more testing, more testing. But it's because public health professionals tell us this is a silent killer. It's not just about first responders and medical personnel and people with symptoms, who, of course, should always be our first priority. But it's also about finding those people who are not exhibiting symptoms, who can walk through crowds and workplaces and spread this without us knowing. And so that's why I'm proud Los Angeles was the first big city to offer widespread testing for people with and without symptoms, because it gives us a chance to know, find those folks, find who they've interacted with, and not just bend the curve, but chase down those cases quickly, isolate them, and help us get to a place where we can better protect from death people and better prepare for an economy that doesn't suffer so much.
And Dr. Patel, you are the guest I'd like to begin this segment with. What about what the White House press secretary said about testing, that in effect it is merely a snapshot in time? You could test people an hour later after an exposure and get a different result. The bottom line being, why bother testing every American?
Well, it's just simply not true, Brian. First of all, we I think all have come to a realization that we simply don't even have enough tests for a percentage of Americans, much less all Americans. So the fact of the matter is that we don't have enough testing, period, and that to kind of offer this contrast that, you know, talking about testing is nonsensical when we clearly don't even really understand what the extent of the disease is in our country. We already know that in parts of our country, we're woefully under testing. And if we are thinking about safely reopening, you've heard it from Dr. Frieden and many other experts just today, that we can't do that without testing. And at this point, we're testing about 200,000 people a day, and that is about at least half of what we need. So, you know, trying to kind of obfuscate the argument by talking about testing every American and it looking different an hour later, well, at this point, I think we need to at least have some sort of testing strategy. And Brian, to be really honest about it, what we need to do is ask the administration, why are we having such gaps in testing? We have been talking about this for weeks and months now. What is it that we need to do to get a real coordinated effort and to deal with the shortfalls?
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.